announced by Senator. Now, Cabinet biggest challenge that county government also indicated well that in the financial year 2018, total of 25 billion 198 shillings, up initial of 11 billion 949 means all 30. Yeah. For that, buy this medicine. If you're having problem, I really would like you to pay attention. If you have problem with drugs being, because county governments drugs, because they have not paid money to EMSA, I think that it is time as a ministry to develop a system where manufacturers ask is about that drug manufacturers only release drugs on payment. Young, I was diagnosed. I know the dangers of. So my question is, don't you time that you develop a robust system that can ensure that all those manufacturers of drugs and only show them down, that you don't have to incur all the debt market. Walking to buy a sugar, that supermarket does not own that sugar. That sugar has been placed there by a manufacturer. The time that it is when he's paying, you have SHA. And then you also have counties collecting money from also houses passed a law. Tell us how we solve that problem once and for all. Not right for people who are sick, epileptic, disabled people who are epileptic, stay without drugs in their hospitals because county governments have not paid drugs of their. Answer that question. Not understood, ask me again.
Honorable. So indeed, drug availability is critical for us. We have one of the key challenges that we have faced as a ministry, ensuring that the drugs reach the last mile, and ensuring that we have accessibility. And under the UHC, that is the Taifa Care, we are really working tirelessly to ensure that, first of all, we have recapitalization of medicines in KEMSA, and again, that they are reaching the last mile, that is to the up to level 2 accessibility. Now, what we have talked about, and we are really ensuring that we will pay, the counties will, SHA will, after the counties have requested, what will happen is SHA will pay directly for medicines before the money is released. That is, when they receive the money from claims, part of the areas, apart from ensuring that they are paying the claims, ensure that medicines are also withdrawn for that, from that money, and that way before the money is released. So it is an area that we are looking into together with SHA to ensure that we are paying up for the rest of the money is released. And that way we want to ensure that KEMSA is routinely recapitalized, it has resources, it has essential medicines. I don't know if I've made
Now you are saying that SHA will pay KEMSA. Question is, happy, come and sit down with having a counties and develop a system that will ensure that these manufacturers place their drugs there, only release them when they are being prescribed to a. That will solve two problems. Problem one, spending bills. Problem number two, expiry of drugs, such that they don't have to be only spend drugs which can be used. Every day we are told what others making drugs to. My question, what you are now saying is that we'll develop a SHA is paid money or the KEMSA releases them? I think I've made it, but now I'll allow my colleagues to piggyback on my question.
But I think answer. Come to your. Answer all the questions. That is part of the. But I know she had to answer, but as a chair, I should also be able to find the house. That is why we have a chair. Kind.
Very much, and we really we appreciate the innovative ideas that you are coming up with, and as I said, we want to work in collaboration and in partnership with the Senate to ensure that we are having medicine at KEMSA and also right down to facility level. So we acknowledge this, and we take seriously and look towards engagement. We're having a comprehensive discussion and a report on health products and technology to ensure that they are reaching the last mile. So again, as I had said, once the county has launched a claim, a patient, what will happen is that SHA will pay KEMSA directly. That's to the medical. SHA will pay directly to that way. That way. Cycle. However, we acknowledge that there are other innovative interventions that we can ensure. We appreciate Senator for the interventions that you have placed in front of us. So we will have maybe engagements on the side to see how we can extensively improve, commodities reaching the last mile. And additionally, we will have a comprehensive report how we are having our health products to at county level, especially at our.
I want to find that I hope you are still the chair for health. And I wanted to. What I want to guide is up. I'm very happy. Approach. I'm happy that we are giving. That is the how do we happy now we are giving. I have that. Undergo. Other question.
Counties and what are you pay? And finally,
One question. You have that under very only induce because you are the one I'm tasking to stop this. Then you are still again.
yes, also telling health. They have a working with it. Honorable Speaker. We have only 2 years. Help this government to make AC properly rolled out, benefits Kenya. When we had our review as a whole, as a committee, feeling, when we have feeling, they are committed, they have innovated. Yes, you have heard what's and we are willing to make our contribution, ideas and innovation on how we can make this work. I've also run health for 10 years. Governor, how we can run. But where is the opportunity to have this discussion?
Commander, those are very valid. Chairman of health. People, whole team can understand under pressure. Just coming. Our concern is really chairman of health is and them that I'm giving guidance on what done on camp. directives that I'm giving, not in so I think give your committee work with that committee.
Want to send our apology for that, that we have been summoned, we've been quite fruitful, very critical concerns that we address. Earlier on, appreciate the work of want to elaborate Taifa Care. Out of three, we attended one that was because I had my. But moving forward, we want to assure you that we'll be working collaboratively in health is